Hello everyone. This presentation is from Tessa, Olivia, and Casey, and it is on increasing students' on-task behavior. For the purpose of this study, on-task behavior is defined as the student sitting without making any vocalizations or sound utterances, finishing the task or assignment, and raising their hand to gain the teacher's attention if needed. For this study, 3 interventions were used in an alternating treatment design: a weighted vest, overcorrection, and reinforcement. The weighted vest, as defined by Stevenson and Carter, 2008. Weighted vests fall under the category of sensory integration therapy. The Stevenson and Carter article follows up in the claims that this type of therapy can help with inattentiveness, hyperactivity, stereopathy, and clumsiness. Overcorrection, as defined by Cooper, is a positive reinforcement procedure as an action is being added to decrease behavior. It is best utilized immediately and repeatedly following the target behavior. It involves performing the correct behavior repeatedly for a number of predetermined times. A variable interval schedule is when a specific interval is set, but responses are not reinforced on that specific interval every time, but they are reinforced on an average of that interval. So if an interval was set at 4, the individual might be reinforced at 1 minute, 5 minutes, 3 minutes, 4 minutes, and so forth, so long as the average reinforcement is achieved at 4 minutes. This makes reinforcement unpredictable and is the best way to ensure a higher response rate during reinforcement procedures. These 2 articles, Riley et al. And Maher et al., both focused on the increasing on-task behavior in elementary children. The Riley article increased on on-task behavior using a fixed time schedule and reinforcing with attention, while the Maher article used physical activity to increase on-task behavior, but their data showed no trend that their physical intervention was effective. Fertel-Daly et al. Utilized weighted vests in preschool children diagnosed with pervasive developmental disorder. They found that it helped increase attention and decrease distractions. They also found that it helped to decrease stereotypy behaviors. They also stated that more studies need to be done to find the effectiveness of the intervention. Vandenberg used weighted vests on children with attention deficit hyperactivity disorder, or ADHD. The author found that the vest helped increase on-task behavior during fine motor activities. For this study, the research question was, by utilizing a weighted vest, overcorrection, and reinforcement, can we increase a student's on-task behavior? So our hypothesis was that variable interval reinforcement will be the most successful in increasing a student's on-task behavior. There were 3 participants: Michael, Erica, and Jack. Michael was 8 years old and diagnosed with autism spectrum disorder. His problem behavior was dropping his writing utensil repeatedly during the day. When he would drop his utensil, the teacher would provide a verbal reprimand, pick up the utensil, and give it back to him. There was no formal plan in place at this time. Erica was a 9-year-old girl who was diagnosed with autism spectrum disorder, and her problem behavior was speaking out of turn. Her behavior was punished with a timeout procedure, but the paraprofessional working with Erica reported this did not work. Jack was an 8-year-old who was also diagnosed with autism spectrum disorder, and his problem behavior was getting out of his seat, which not only distracted him, but his classmates as well. The setting for the study was at a school that the children all attended, 8:30 to 2:30. It was conducted 5 days a week, with each child being in a different classroom. Each room was equivalent in space, having 900 square feet, with a 4x6 whiteboard at the front of the room, a teacher desk with a swivel chair, and a wall clock. The sessions were 60 minutes long and conducted between the hours of 1 p.m. and 2 p.m. Each child had 20 sessions with alternating treatments and a baseline that lasted 3 sessions. Each student was given a desk that had an open front and plastic top, paper, a pencil with an eraser, and a worksheet that had varied content according to the child's proper skill level, a weighted vest during the weighted vest condition, a preferred edible reinforcer during the reinforcer condition, and a paraprofessional that was equipped with a timer, stopwatch, tally clicker, and pencil and paper to take data. The students were told they needed to remain quiet, refrain from talking to peers, and to raise their hand if they had any questions. For Michael, 30% of his sessions had inter-observer agreement data taken, with an average of 96.97% of agreement. 30% of Erica's sessions also had inter-observer agreement data taken, with an average of 93.18% agreement. 30% of Jack's sessions had inter-observer agreement data taken as well, and his agreement was 100%. For procedural reliability, the supervising researcher trained all paraprofessionals on frequency data recording, duration data recording, how to place the weighted vest on each participant, how to implement overcorrection procedures, and how to reinforce on a variable interval DRO schedule. Additional literature was provided, as well as additional training if requested. When the supervising research evaluated the paraprofessionals, the agreement for Michael was 92%, for Erica it was 100%, and for Jack it was 96%. The criteria to be able to conduct sessions was 80% agreement, and all paraprofessionals passed. Baseline data was taken for the first 3 sessions, and no intervention was provided by the researchers. All baselines were conducted between the hours of 1 and 2 p.m., and the duration of on-task behavior was recorded for each student, and frequency data was taken using a tally clicker for the number of times the pencil was dropped by Michael, the number of outbursts by Erica, and the number of times Jack got out of his seat. For the weighted vest condition, the vest was placed on each participant 5 minutes prior to the session beginning, and the timer began when the teacher gave the participant the worksheet. For this condition, the paraprofessional sat 4 feet behind the participant and recorded frequency data on how many times the problem behavior occurred, and duration data was taken on how long the participant was on task. When the timer reached 60 minutes, the vest was taken off and the session ended. For the overcorrection condition, the timer began when the teacher gave the participant a worksheet. This condition had 2 paraprofessionals, where one sat 4 feet behind the participant, utilizing the timer and recording frequency data on the problem behavior and duration data for being on task. The other paraprofessional was next to the participant at all times in order to implement the intervention. Physical prompting was used for each participant's overcorrection procedure. Michael's procedure was to have the paraprofessional hand over hand prompt Michael to pick up the pencil, place it on the desk, and then drop it on the ground. This was repeated 5 times. Erica's overcorrection procedure was to have the paraprofessional hand over hand prompt her to physically raise her hand and drop it 5 times in a row. For Jack, he was prompted by the paraprofessional to stand up and sit down 5 times in a row. When the timer hit 60 minutes, irregardless of problem behavior or on-task behavior, the session was ended. For reinforcement, prior to the study, an indirect assessment was conducted to determine proper and practical reinforcers for each participant in the classroom. Each participant's family and teachers identified at least one edible reinforcer, so at the beginning of each reinforcement session, the participants can choose an edible reinforcer. As with all other sessions, the timer began when the teacher gave the participant a worksheet. There were 2 paraprofessionals for this condition as well. One sat 4 feet behind the participant recording frequency and duration data, while one stayed next to the participant in order to immediately reinforce on a variable interval DRO schedule of 10 if the student was on task. At the end of 60 minutes, the session was terminated. In order to determine and make sure the interventions chosen were socially valid, questionnaires were given to each participant's guardians and each teacher in the school. 100% surveyed said they were okay with all interventions. They were also asked to rank which interventions they would prefer. 75% preferred reinforcement, 20% preferred overcorrection, and 5% preferred the weighted vest. During the baseline, there was no intervention from the researchers provided for Michael. He dropped his pencil 19 to 24 times, and his on-task behavior ranged from 19 to 27 minutes. During this phase, the teacher would pick up the pencil, place it on the desk, and walk away. After this occurred, Michael would drop his pencil again and laugh or stim until the teacher came back, picked it up, and placed it back on the desk. For the sessions in which the weighted vest was used, he struggled to keep it on and had 15 to 17 drops with no trend, while he only had 11 to 29 minutes on task, which is a decrease in on-task behavior from the baseline. For the overcorrection sessions, Michael would whine and cry when the procedure was implemented. However, he had 17 drops at the beginning of the intervention, but at the end he only had 2 per session, and his on-task behavior increased from 20 to 53 minutes. For the reinforcement sessions, he was provided with praise and Oreos, and he started with 14 drops but ended with no drops per reinforcement session. His on-task behavior increased during this intervention as well, going from 40 to 52 minutes. Here are the figures for on-task behavior in minutes on task. As you can see, the weighted vest had little to no therapeutic effect on the 2 behaviors being measured, while overcorrection and reinforcement had clear therapeutic effects for the behaviors being measured for Michael. During the baseline phase for Erica, she had 10 to 11 speaking out of turn behaviors and remained on task 28 and 44 minutes. The researchers did not perform any interventions. However, the teacher gave a timeout every time Erica spoke out of turn, but was not redirected when she left timeout area early. When Erica had the weighted vest on, she often tried to take it off, and her speaking out of turn increased from 8 to 15 times, while her on-task behavior decreased from 28 to 11 minutes. During the overcorrection procedure, her speaking out of turn behaviors decreased from 9 to 3 and had a steady decreasing trend, while her on-task behavior increased from 34 to 48 minutes. And she even began to raise her hand on her own several times. During the reinforcement session, even though she had chosen an edible reinforcer, she was also provided with praise, movement breaks, and piggyback rides when able. Her speaking out of turn behaviors decreased from 9 to 2 times, and her on-task behavior increased from 45 to 54 minutes. As you can see from these figures, reinforcement and overcorrection had the largest therapeutic impact on her behaviors. During the baseline phase, Jack was out of his seat 41 to 52 times and only had 0 to 2 minutes on task. For the weighted vest sessions, Jack's out-of-seat behaviors decreased from 30 to 11 times and had a sharp decreasing trend, while his minutes on task increased dramatically from 39 to 49 minutes. During the overcorrection procedure, his out-of-seat behavior increased from 41 to 53 times, and his on-task behavior was only 0 to 3 minutes. The overcorrection sessions were most similar to baseline numbers. During the reinforcement sessions, however, Jack was provided with a squishy ball, Play-Doh, Tootsie Rolls, and Goldfish crackers. His out-of-seat behaviors when being reinforced on the VI-DRO schedule decreased dramatically from 9 to 1 times, and on-task behavior increased from 50 to 59 minutes. As you can see from the figure, reinforcement had the largest therapeutic effect, followed closely by the weighted vest, but the overcorrection intervention had no effect on Jack's behaviors as the numbers were just a continuation of baseline results. The results show the best intervention for Michael, Erica, and Jack was the VI-DRO reinforcement schedule. This study helped identify interventions that can help increase on-task behavior in a classroom setting. It also identified interventions such as the weighted vest that might not be so practical and effective in a classroom setting. This study focused on elementary-aged children, but different ages might react differently to the interventions used, and some interventions may impact students better than others, as exhibited by the overcorrection and weighted vest results for the participants in this study. Also, factors at home were not taken into account, such as not having enough sleep, not eating well, or not feeling well. Also, factors from the previous day were not taken into account. Any future studies would do well to use the same age, or at least students from the same grade, and attempt to do these types of interventions on older or younger students. It might also be effective to use different interventions or variations of the intervention used in this study, such as a variable ratio schedule instead of a variable interval schedule. It can also be potentially helpful to perform a study of this nature at a different time of day and on non-autistic students as well. Here are the references used, and thank you very much for listening to our study.